Welcome to today's Better Hearing webinar. My name is Caitlin Whitson. I'm a clinical assistant professor at UNC Chapel Hill and clinical audiologist. I am joined today by Nicole Oldrati, who is our fourth-year doctoral extern at the UNC Hearing and Communication Center in Chapel Hill. Nicole will be graduating in just 2 short months, and she will be an audiologist as well, working with patients, hopefully in the Raleigh or Triangle area once she graduates. Today, we're excited to be talking to you about integrating lip reading and other communication strategies to help improve communication as a whole. Some information about our clinic. If you're not familiar with us, or if you're watching this on YouTube, oops, let me go back. Trying to let people in at the same time. Sorry about that. This is some information about our clinic. We are not on the main campus, but we are off of Farrington Road in Chapel Hill, North Carolina. We work with adults with hearing aids, hearing protection, and we also do balance and tinnitus specialty testing. So we are a practice that is part of the School of Medicine with UNC. So we serve as also a training clinic for our doctoral students who are learning how to be audiologists. Please write down this link to our YouTube channel if you're not subscribed already. We post new webinars there once a month. And if you're watching this on YouTube, please subscribe if you're not already and like this video. Our Facebook page is also listed down there at the bottom. And if you don't know how to navigate YouTube exactly, but you're on Facebook, if you follow us, you'll also see when new webinars are posted. So this coming Friday is World Hearing Day, so we wanted to take a second to shout that out. This is supported by the World Health Organization, and we're trying to promote the importance of ear and hearing care all over the world, and we want to raise awareness for the prevention of hearing loss. Today, we're going to be talking about lip reading, speech reading, communication strategies. So let's start by talking about what lip reading is exactly. So it's more than just what we see on the lips. In fact, it's the perception of speech by interpreting all of the visually available movements of the face, mouth, and tongue. And so we're associating a meaning of some word or some speech sound with what's viewed on the outside of someone's face. So really, we all use lip reading to some degree, and it's how the brain interprets the visual information from the face, lips, and teeth that helps support maybe what our ear does not hear so well. And so this is certainly true for people who live with hearing loss. The eyes help support what the ear is not hearing. But even for people with normal hearing, if we're in a challenging listening environment, like a noisy restaurant or a sporting event, somewhere with poor lighting, well, not poor lighting for hearing, but anywhere where someone's a little bit farther away, or if there's an unfamiliar dialect, using our eyes really helps support our ears for speech understanding. So to highlight the integration between the eyes and the ears, I have this fun little video to watch, and I hope you all haven't seen it before. It's really kind of an eye-opening video when you first see it. So I'll let you watch. And if you have sound on your computer, you'll want to turn it up. I guess one thing I just thought about, I want to make sure you can actually hear this, and I'm not sure that I shared sound with you. So 1 second, let me do that. Let me just reshare. Okay, now we're sharing sound.
Ba, 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 ba. Ba, 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 ba.
So I'm going to go back and play the second half of that again and listen to it by watching him, and then close your eyes and listen and see how the sound changes.
Ba, 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 ba.
So our visual sensory input can sometimes even override what our ear is hearing. So this integration between the eyes and the ears is done so quickly in the brain. It's almost, can you trust everything you're hearing? So when we're thinking about lip reading, we wonder, well, how useful is it actually? And English especially is particularly difficult to lip read because so many of our speech sounds rely on the differences in tongue position inside our mouth and throat to determine the meaning of the sound. So really at best, only about 30% of English speech is visible on the lips alone. So think of the example of sun versus none, and just say that to yourself. And pay attention to how your lips look from maybe from the outside and where your tongue is hitting inside your mouth. Another example of not being able to tell the difference between different sounds is if you're just lip reading, some speech sounds may have the same tongue position, but either our vocal folds are vibrating or they're not. And so we call this voiced versus voiceless sounds. So if you were trying to talk to someone about a den versus the word 10 with a T, on the lips, they look exactly the same. You need to be able to hear the vocal fold vibration to tell the difference. Or you need to use your context clues and understand that, 10 doesn't make sense there. The word must be den instead. So there's an aspect of auditory processing at play by picking out these context clues. So I want you all to say these 6 words out loud. Pay attention to how your lips are moving when you're saying these words. You probably notice that they all are moving in the same way, yet these are all distinct words. So they're homonyms, or they sound about the same, even though these words have different meaning. So lip reading is really difficult to do in isolation without any context clues. coarticulation adds another layer of difficulty to this. And this is when coarticulation is when two or more speech sounds flow together and one is influencing how another one is pronounced. And so coarticulation, or a change to the speech sound, could happen to a single sound, or for my linguistics focused people, with a phoneme of speech. And that could be within a word, or it could be over a combination of multiple words. An example of within a single word, if you think of the word happy, for example, an H sound has no shape on the lips. It's just pushing air through your mouth. But if you say the word happy, you'll notice the H is already, your mouth is forming the A from happy as you say the H. Versus the word hoppy, the H sound is taking the shape of the ah in hoppy. Looking at the picture on the right side of the screen, you can see really common examples of phrases that become co-articulated in English. We don't really say, I want to go. We'll say, I want to go, and shorten it. And having this element of co-articulation is the difference between a robotic sounding speech and natural fluid speech. So our brains are always working 3 steps ahead of us. So the research behind lip reading is pretty outdated and pretty limited. Lip reading has been around for centuries of people trying to teach it to people who are deaf or living with hearing loss. And there's been lots of failures with that, as we know now. And people who are born deaf do much better by learning a manual sign language, whether that's signed exact English or American Sign Language or any other form of sign language. But some people do look into, how do I get better at lip reading to help supplement my hearing? The research that is out there suggests that younger people tend to do better at this. So there's an age effect here. And we think that's because younger people tend to be better at pulling out context clues, and they have a faster working memory and auditory processing compared to older adults. You know, this really makes sense, because auditory processing is something that we know declines as we get older. And lip reading is this integration of the visual and the auditory information. So with auditory processing, this is essentially how the brain is making sense of what you hear. And it's impacted by our hearing status, so whether or not we have hearing loss. It's impacted by our age. It slows down as we get older. And of course, your memory and your cognitive status also play a role there. So when I see patients in my clinic for hearing tests, I'm always trying to tease apart, what is a hearing loss problem? What is an auditory processing problem? Or how much of each of those things are contributing to the communication problem the person has that's sitting in front of me. So excluding the hearing loss aspect of it for a moment, some signs of a decline in auditory processing are difficulty understanding accents, difficulty following fast speech, and of course, difficulty hearing in background noise. And for a lot of you watching this, you're probably living with hearing loss as well, and hearing loss is an extra added layer on top of this. So lip reading is now more commonly referred to as speech reading, And there are some speech reading therapeutic techniques that are taught by speech language pathologists, specifically auditory-verbal therapists. This is usually used when people receive cochlear implants and are learning how to hear, maybe for the first time. And so they're reinforcing what they hear with also using visual cues. So this is mostly used with children. A lot of the time, these children are primarily being taught American Sign Language, and the lip reading or the speech reading techniques are in order to supplement what they're learning as a manual language. So using speech reading techniques in a rehabilitation clinical setting is becoming less and less common as our hearing technology improves. So at this point, we've identified that speech reading alone or lip reading alone in isolation is really not the best focus for improving our communication. It's really an innate ability. We all can do it to some degree, and there's really not research that supports that doing a training program for a certain number of hours will improve your ability to speech read by some percentage. It's either you can do it or you can't. Instead of focusing on this isolated speech reading training, we really want to focus on maximizing your hearing and your vision abilities. We want to use communication strategies, and we'll dive into that in a moment, because knowing what strategy is best to use is half the battle sometimes. And we want to modify our listening environments whenever possible. So at this point, I'm going to hand it over to Nicole Oldrati, who is going to talk to you about good communication.
So let's talk about good communication. There are 4 main parts of communication: the speaker, the message, the listener, and the environment. Well, taking that into consideration, what factors affect communication? And a lot of you might already know the answer to this: background noise, an echo, high ceilings, distance from the sound source, visual cues, being able to see somebody's face. What kind of hearing loss, if any, do you have? And how familiar is that person to you? So looking at each part of communication, we want to know how to repair the breakdown. We want to know at what point is there breakdown and what can we do to try and become better at those specific parts of communication. The first thing that we want to talk about is modifying the speaker. Now, if you are the speaker and you're talking to somebody, regardless of what their hearing status is, but more specifically, if someone has a hearing loss, you want to make sure that you speak slowly and clearly. And if you have a hearing loss, you might already know this, that sometimes increasing the volume doesn't always help understanding speech. More so, it's the clarity of speech. So if you're the speaker, yelling might not actually get the sentence or the phrase that you're trying to say in, help them understand it better. It might just make them annoyed. You want to make sure that you're enunciating your words and having enough pauses so that if the person has to play catch up and their brain has to kind of tease out what's being said, they're able to do that with those pauses that you've given them. Like Dr. Whitson has already talked about, visual cues are important. When you can see the face, it's going to aid in what you're hearing. It gives you confirmation that you're hearing the right thing. And the distance between you and the speaker or you and the listener are going to be very helpful or detrimental, depending on how far or close you are. If you're close to them, the speech doesn't have to travel as far, so the sound won't diminish as much. Now let's look into the message itself. Repeating important keywords, if you can tell that whoever you're talking to is having some difficulty grasping what you're saying, but also rephrasing what you said. Sometimes it's that one word, that key word that they can't pick up. They're not comprehending it or they're not hearing it as well. And if you rephrase the sentence, they might be able to get enough context clues to understand what you're saying. The shorter the sentences and the simpler the grammar is also going to be helpful because they're able to grasp onto that one thought, kind of comprehend it, and then move on. If you have a long-winded sentences, they have to keep up with the entire sentence. Another thing that a lot of people, regardless of hearing status, do is they use pronouns. Hey, can you go pick up that? Well, what is that? If you say, hey, can you go pick up the phone? Okay, well, now I know what you're talking about. Let me go do that for you. So being specific with what you want and need is helpful. And now let's talk about the environment. Some cases, it's not totally possible to change the environment, but when you can, you should. Limiting background noise is going to help in every situation. It's going to help your brain focus and get rid of the distractions. Turning off the TV or music, or if you're in a restaurant, asking for them to reduce the volume of the music or sit in a booth near a wall, not in the center of the restaurant, are all ways that you can modify your environment so that you're going to be able to hear better. Same thing goes with the lighting. If it's really dark, you're not going to be able to look at somebody's mouth and get visual cues. Or if it's really sunny and you've got a backlit window and all you see is shadow, you can't see somebody's face there either. So being able to move to a well-lit area where facial cues can come into play is going to be helpful. And lastly, let's talk about how the listener can modify themselves so that they can hear better. If you have a hearing loss and you have hearing aids, you should wear them. That's going to give you access to sound and the ability to hear what's being said, in addition to any assistive device that you might have, like a remote microphone or a partner mic that you can give somebody so that they can talk into it and you have the ability to hear them in your hearing aids. Any kind of visual cues or speech reading abilities that you have, it's going to be helpful because it'll give you context clues. And again, that confirmation that what you're hearing is actually correct. Of course, keep a positive attitude because I know it can be frustrating if you're not hearing everything that's being said, but asking for written summaries or confirmation if that's possible, or asking someone to rephrase what they said, and anticipating what kind of vocabulary is being used if you know what the topic is. I've got some examples down there. If you're in a grocery store, you kind of have a bubble of what's going to be talked about if you're talking to, let's say, the register, or same thing with the bank teller. You have an idea of what's going to be discussed. So you're anticipating that in that vocabulary, kind of being proactive. All of this is great, but being able to advocate for yourself is going to be the best way for you to hear better. Because some people, especially if they don't know anyone with hearing loss or don't have hearing loss, they don't realize or understand that the hearing aids don't give you normal hearing again. They're just giving you access to sound. And there are other ways, different communication strategies that are going to help emphasize and benefit in addition to the hearing aids. So if you're willing to tell people that you have hearing loss and that you have hearing aids and, tell them, hey, I need to sit in a booth if you're at a restaurant, or tell somebody, hey, can you look at me so I can see your face so I can get some visual cues? Taking the lead and being able to tell people, this is what I need so I can hear better. People are going to respond, or they should be able to respond to that and accommodate accordingly for you. Now, I know I keep talking about visual cues and being able to see people and stay close to them, but the pandemic kind of threw a wrench in that. And so now there's social distancing and masks, where if you're far away from somebody because you're trying to social distance, speech has to travel a lot longer and a lot farther, so that speech starts to diminish. And if they're far away, you don't really get visual cues because it's a lot harder to see their face. Even if they're close up, if they have a mask on, 70% of their face is covered by a mask. So you lose the ability to lip read. You also lose facial expressions. Someone smiling or frowning, that also helps with context clues. And masks in general tend to muffle or reduce the volume, especially in those high frequencies where the clarity of speech lies. So then what the heck do we do about it? If you're wearing masks and you are with people who have hearing loss, or you have hearing loss and you know that it's difficult, consider a clear mask so that people can still read your lips. And if you are wearing hearing aids, making sure that they're still functioning appropriately and they're optimized for your hearing loss, that's always going to be helpful because you know you're getting access to sound. Those communication strategies, those extra steps that you can take in addition to wearing your hearing aids, are going to help overcome the distance and masks. And again, advocating for yourself, telling the person what you need so that you can be successful. So there are different conversation styles that occur, and different types of people use different conversation styles. Aggressive styles are someone who dominates the conversation, and when they can't hear someone, they blame somebody else. Oh, it's because so-and-so mumbles, or because they talk fast. And so they themselves decide that they'll talk the whole time, so they don't have to worry about mishearing anything else. And then you have the passive style, where you kind of laugh it off and nod your head. You're not really getting it. You're not totally in the conversation, but instead of speaking up and saying something, you kind of withdraw and you just sit there and nod and let people pretend to know that you pretend, and they think that you're with it, with the conversation, understanding what's going on. And assertive, last but not least, is one I want to talk about a little bit more specifically. This is that sweet spot, a nice combination between aggressive and passive. The assertive style is a way that you can advocate for yourself while still being respectful and considerate of the communication partner you're with. Expressing your needs openly and letting them know if you're frustrated, if you can't understand them, or if there's a breakdown in your communication, take responsibility for it and try to advocate and be able to fix the environment, the listener, the message, any of those aspects so that you are able to hear better. And if none of that works, you can offer specific suggestions like rephrasing the sentence or trying to have the person repeat key words. And I've got a couple of examples here that we can go through. So scenario number one, you're on the phone with a plumber and you've missed a couple of words and you're not totally sure what he said. What do you do? In the moment, you can ask them to repeat or rephrase or you can ask them to speak a little bit clearer or slower. And what's always best is you can ask for a confirmation email. So it's all written down, that confirmation that what you're seeing equals what you're hearing. But then in the future, what you can think about too is maybe you get an amplified phone, or if you have hearing aids and you have Bluetooth capability, you're able to stream your phone call to your hearing aids so that you have a more direct phone call and direct line to be able to hear. There's also caption phones, so the dialogue gets written out for you while the other person is talking, which will, again, help with visual cues, gives you confirmation that what you're hearing is what they're saying. Another scenario is if you're unable to hear a conversation at a noisy restaurant and it's with your own table. What are ways that you can modify the environment, the listener, the speaker, or the message so that you can hear better? And in the moment, you can ask to move to a quieter place. You advocate for yourself and let the host or the server know that you have hearing loss and you're having a hard time to hear. Or even if you don't have hearing loss, that you're having trouble hearing and you'd like to be moved closer to a wall or in a booth. You can also ask your group, if you're with multiple people, to take turns talking so that you can concentrate and focus on one person at a time. And then for the future, if you really like to go to a certain restaurant, but maybe they have poor lighting or they have a lot of people once it hits 6 p.m., maybe you decide that you go at 5 p.m. when there's not as many people, it's not as loud, so that you can adjust the environment to help you hear better. Anything that is soft is going to help you hear better as well, because sound won't be able to bounce off the walls if there's carpet, if there's a bunch of wall hangings or plush seatings. If the acoustics in the restaurant are poor, high ceilings, wood, hard surfaces, it's going to make it harder to hear because that sound is going to bounce off every hard surface that it can, and it makes it a lot more muffled, a lot softer when it gets to your ears. There's a couple of resources here that help with oral rehabilitation tools, as well as just knowledge on communication strategies and hearing loss. The first one up there is the Hearing Loss Association of America. They're a nonprofit organization who want to help the world understand communication with people in regards to hearing loss. They have information, support, education, and they help give resources to people and families who are, have hearing loss and are affected by hearing loss. There's also a North Carolina branch specifically, and both of those links are there for you to look at. The last one there is the IDA Institute. They're also a nonprofit organization that go through oral rehabilitation tools for providers and also for patients who have hearing loss so that they can use different tools and aspects in communication strategies, not just hearing aids, because hearing aids are only one tool in our toolbox. So some takeaways from today. We know that speech reading is an innate skill. Everyone can do it to some degree. It just depends on how much everyone can do. Not everyone's got the same level. We also know that the English language only has about 30% of words that are going to be visible on the lips. So using lip reading or speech reading alone is not going to be the best way to communicate. You want to advocate for your listening needs with your communication partners and the environment that you're in. Communication is a two-way street. So not only do you have to be open to the communication and advocate for yourself, you have to let whoever you're talking to know what's going to make you hear better, what they can do to make you hear better. Of course, be patient. And when you have hearing loss, it's usually going to be a combination of wearing your hearing aids all the time, as well as utilizing those communication strategies. Like I said, hearing aids are not going to give you normal hearing, They will give you access to sound, but being able to process that sound, especially in different environments, you need those communication strategies to help benefit and utilize the hearing aids that you have. It's going to just add to what you're already given. And lastly, you want to make sure that your hearing aids are clean and they have up-to-date programming and they're optimized so that you can hear best.
Please feel free to use the chat box for questions for our live audience. I'm going to end the YouTube recording at this point. So if you're watching this on the YouTube channel, please give us a like and thumbs up, and we'll see you next time.